Hello, good morning, good afternoon, good evening, depending on when and where you're watching this video from. I'm Dr. Katie already on home. There is something for us to learn today. That is why I am here. Today we are going to be talking about routine checkup, routine hospital visits, or routine evaluation. What this means is that you go to the hospital to check up on your vitals, to check up on your systems, on yourself, and be sure you are doing well. Not necessarily because you are sick, not necessarily because you have a symptom or anything that's taking you to the hospital. And this is done in order to prevent disease, promote health, and in some cases, encourage early diagnosis and treatment. Okay? Some people tend to shy away from routine evaluation for some reasons. One, they will say the queue is too much. When I'm not sick, I'll go and wait a whole day in the hospital trying to get myself checked up. That's one. Two, some people are scared. They will say, I don't want to go because what I don't know won't kill me. That's not true. That statement is a wrong statement. They tell you that they will just better not know, let it be there, instead of knowing and then dying from it. It's not true. When you know, there are some things, when you know early diagnosis will help in the management and even cure such things instead of presenting at the late stage of the disease. Early diagnosis is better at all times. Even prevention is better than cure. Okay, when you continue on routine checkup, routine evaluation, you are able to diagnose early, you are able to prevent disease, you are able to promote health and support healthy living. Okay, so don't run away from routine checkup. But some other people, that's two now. The third one is that some people don't know what to do during routine checkup, so they are discouraged. So I'm here to let you know that for routine checkup, there are things you have to do. And I'm going to take this in two pathways. People that are been doing routine checkup and they need to be optimized. You need to let them know all the things they need to do in the course of routine checkup. And people that have never done that are going to start the way to start. Okay, so what are the things you check during a routine checkup? Blood pressure. You check your blood pressure, and mind you, it can be normal and it can be high. It can even be borderline. They will not advise you to integrate routine exercise, to reduce your salt intake. You try to rest. They will ask if there's any stress factor around you, the death of a loved one, the stress, the loss of a job, a divorce and all that. So they will ask if there's a stress factor around you. If there's a stress factor, then they will follow you up. They will ask you to come back again, check your blood pressure. Okay, you don't make the diagnosis of hypertension following one blood pressure reading. The only time they will make that diagnosis following one pressure reading, they just check it for once and put you on drugs, is if it's very high, malignantly high blood pressure. For example, I'm meeting somebody in the clinic today and the blood pressure is 240, 130. I will not ask the person to come back for a repeat blood pressure, okay, before I cannot make diagnosis of hypertension or before I cannot treat. Because if I ask that person to go, the person can have a stroke, okay, and something, cardiovascular accidents can happen to that person. So for such people with that kind of blood pressure, in fact, you can keep them in the emergency and observe them, because the treatment plan is not also to drop the blood pressure once. So you just observe them and monitor vital signs and gradually drop blood pressure, okay, over 48 to 72 hours. You don't just see somebody now and drop blood pressure. If I drop a blood pressure of 240 over 110 or 120 to 120 over 70, the person will become unconscious. And do you know why the person will become unconscious? That person must have been living with that very high blood pressure. And there's what they call autoregulation. There's autoregulation in the brain. They call it cerebral autoregulation. There's autoregulation in the kidneys. They call renal autoregulation. What it means is that anytime your blood pressure is rising, this regulation will now become high. Meaning that it is only at this high set blood pressure that the brain and the kidneys can receive blood pressure. If you suddenly drop those blood pressure, the kidneys will not receive blood supply. The kidney will not be injured. The kidneys will not be injured. So it can precipitate an individual to acute kidney injury. Or the person can become unconscious because of cerebral hypoperfusion, meaning that the blood was not supplying the kidneys, the blood was not supplying the brain. Okay, this is because you suddenly drop high blood pressure to a normal blood pressure. You don't do that. You do it over time. And for people that you not place on blood pressure drugs, those autoregulation will return to normal in a matter of 2, 4, 6 weeks. Okay, 2 to 4 weeks. It will return to the normal regulation, auto regulation, so that blood can supply them at normal pressures. Because it's not for exam, I will be telling you the normal cerebral perfusion pressure and all that. It's not important. I've told you I will use languages that you will understand, because the aim here is not for you to go and write a medical exam and pass. It is for you to be able to have information and prevent disease. Okay? So this is why it is dangerous when a doctor tells you, or you go to a pharmacy, you just check blood pressure, and they tell you, your blood pressure is high, and you don't say, give me medication. They can look at it, that the blood pressure, and they give you a drug that is very high, and now put you on a high dose, and suddenly drops your blood pressure. That can cause accidents, can cause cerebral ischemia. Okay? And that can make somebody unconscious, like I told you, it's a lot of trouble. So you must be sure that whoever that is starting you on blood pressure medication is a doctor. Because it's a drug that when you start, you're going to be on it most times for life, except for some people who had stressor, or people who were treated in ICU, or who had significant illness that was stressful enough that their blood pressure at that time rose. And after that illness, their blood pressure now settled. For such people, they also monitor them, they follow them up to know when to withdraw the drugs if the blood pressure returns to baseline, to pre-admission blood pressure. Otherwise, anytime you are giving antihypertensive because of elevated blood pressure, be sure it's a doctor that is giving you, meaning that you are qualified to start that drug. Don't just start. You don't make the diagnosis of hypertension following one blood pressure reading. Okay? And the 2 or 3 times, there are periods in between. If the blood pressure is not too high, and they can monitor you, they can even advise you for a good sleep. They can even give you some anxiolytics, some drugs to keep you calm so that you can sleep well, to be sure that it's not the immediate stress you are in that is rising your blood pressure. Another thing you need to check following a routine checkup is blood sugar. You need to check your blood sugar all the time. For routine checkups, you should be able to do 4 times in a year, every 3 months or 6 months, depending on your age and the risk in your family. For example, they will say their parents are hypertensive, diabetic, or anything that runs in the family will not determine how often you need to do your routine checkup. But at most you can do is 4 times a year. It should not be more than that. When you don't have any comorbidity, you are monitoring. Okay, routine checkup should not be more than 4 times a year. So another thing, aside blood sugar, when you check a blood sugar, of course it can be normal. I told you routine blood check cannot put there what is not there. All through your life, it can be normal following a checkup. And it's also true that in the course of your routine checkup, you can pick something that is beginning to rise, and your doctor will not cancel you. Your blood sugar is borderline, it's beginning to rise. Monitor or be careful with what you eat. Don't take sugar, don't take this. They will place you on diet. They will advise you to lose weight. Do routine exercise, regular exercise, and all that. Drink water, so they can cancel you in order to prevent it. At least, even if it's going to come, shift it to a later date. You understand? Let it not come now. Even if it's going to come later in life, at least you should be able to have some days, some years. Some people who they were told, that the blood sugar is beginning to rise, and they followed precautionary measures, that was given to them by the doctor, and they ended up having longer years, maybe 10, 20 years later, before they now manifested with the diabetes. Okay, that's a good sign you have bought for yourself, because you took routine evaluation seriously. And for such people, if they are telling you today, maybe you went for a routine checkup and they now say your blood sugar is high, what you should just immediately do there, you should do glycated hemoglobin. They also call it HbA1c. What you have to do, that one will tell you whether your blood sugar has been controlled over the last 3 months, or it is just, if it's just a thing that is just starting, or it has been there for the past 3 months. Glycated hemoglobin will tell you the blood sugar control over the period of 3 months. So another thing you have to check too, and be sure anybody who's going to start you on diabetic drugs must be a doctor, because there are different types. We have type 1, we have type 2. They need to evaluate you, they need to investigate you, okay, they need to examine you. You should not just start such drugs by yourself. You must be sure it's a doctor that is starting you up on those drugs, because they are very important drugs. So after a blood sugar, another thing you have to check routinely is lipids, lipid profile. When you hear lipid profile, we're talking about the amount of fats in your blood. Is it a cholesterol? Okay, that is in your blood, is it elevated? And when you talk about lipid profile, there are components of the lipid profile. It will assess your cholesterol, it will assess your triglyceride, the other ones they are fat. It will assess your high density lipoprotein, which is the good one. It will assess your low density lipoprotein, which is not the good one. So it should not be high and all that. So when they assess this all the time, they will tell you when your fat is normal, is low, or is beginning to rise. There are precautionary measures you have to take in all these systemic diseases when it's beginning to rise. And it can be normal too all through life, like I've been saying in all. Okay, you must check your lipid profile, and you must know the risk that this puts you, so that you'll be glad you are taking routine health evaluation seriously. Okay, what are the risks? Do you know that hypertension will put you at risk of stroke? Okay, and all the organs, there are organ systems in the body that hypertension will affect. There's what they call hypertensive heart disease. Okay, there's what they call hypertensive retinopathy, that's your eye. Hypertension can cause problems in the eyes. Hypertension can cause problems in the heart, that's hypertensive heart disease. Hypertension can cause problems in the kidneys. They will say hypertensive nephropathy. Okay, hypertension can cause problems in the nerves. They will say hypertensive neuropathy. Hypertension can cause problems in the vessels. The wall of the vessels will now become thickened. Okay, arteriosclerosis. Okay, all this hypertension can cause. So for that reason, you have to ensure that you do a routine check and ensure your blood pressure is not rising. And for people that blood pressure is rising, or they're already on antihypertensive, you must follow up your clinic, and follow up your clinic days, your control, so that you achieve a well-controlled blood pressure. And when you have a well-controlled blood pressure, you are good. You live your beautiful life. The risk and the complications associated with hypertension will be delayed. They will come because your blood pressure is well-controlled. So for blood sugar, there's diabetic retinopathy, diabetic nephropathy, diabetic neuropathy. It will affect all the systems. Okay, even cardiac infarction will be happening in a diabetic, and it will not even feel pain because the neurons, the nerves have been injured or destroyed by diabetes. So for that reason, you must ensure you take routine health checkup seriously, so that you can prevent disease or monitor or manage appropriately whatever situation that you are in, and still live a beautiful and a healthy life. And fats in the blood will put you at risk of ischemic stroke, because it can block the vessels that supplies the brain. It can block the vessels that supply the heart. It can put the person at risk of myocardial infarction. That's part of the heart will not receive blood supply. It will not be dead, and it can rupture. It can cause sudden collapse. It can cause cardiac arrest. It can cause arrhythmia, and it can be the reason why blood clots will be generated in the heart that will not cause pulmonary embolism. That's the blood clot will not go and block somebody's lungs. The person will not be able to breathe well, or the person can suddenly collapse and die. Okay, so blood fat is also important to check blood fat. And one thing you must know, it's not people that are fat that will have abnormal blood fats. Okay, abnormal lipid profile. No, both slim and fat people can have abnormal lipid profile. So that you won't say I'm slim, I won't do my lipid profile. Okay, you need to do your fasting lipid from time to time, especially when you are above 45. Okay, another thing that you can check is your renal function. Renal function is the kidney functions. Okay, in checking kidney function, you do what they call electrolyte, urea, and creatinine, because there are levels that are supposed to be normal in the blood if your kidneys are working very well. Okay, another thing you need to check is your liver function. You check your liver function and be sure that the liver is doing what it has to do. And another thing you must do, especially when you are starting a routine checkup for the first time, you should do this for all the members of your family. You should do virology. And what constitutes this virology? 1, hepatitis B surface antigen. You should do that. You should do hepatitis C virus screening, okay? And you should do HIV 1 and 2. And when you do this test and hepatitis B surface antigen is negative, you need to give vaccine to every member of your family to protect them against hepatitis B. Okay, another thing, you can do hepatitis B combo in case you have taken vaccine before for hepatitis B. It will show whether the vaccine that you took before, you were able to achieve antibodies. Okay, so there are 2 things you need to know here. There's what they call vaccination, and there's what they call immunization. Okay, vaccination is the art of inoculating antigens that will stimulate antibodies. The process of giving that antigen is referred to as vaccination. They call it inoculation of antigens that will stimulate immune response. While immunization is the production of antibodies against the antigens or processed antigens that have been given in order to achieve immunity. All right, you now form antibodies like a police that will help you fight infection. It's when you have been able to produce these antibodies that you now say you have been immunized. Otherwise, your process of going to receive the vaccine is called vaccination, not immunization. All right. So, if you screen your family members for hepatitis, for those that are negative, you should give them hepatitis B vaccine, because hepatitis is the leading cause of liver cancer all over the world. In preventing a liver cancer, you must be sure that you have prevented hepatitis, okay? And then prevent hepatitis from viruses while you stop drinking or reduce your alcohol intake in order to prevent hepatitis from alcohol consumption. We'll come to that. I have a video trending on hepatitis. All parts of everything you need to know about hepatitis is there on Better Preventing Disease. Check it out on my YouTube page. Everything is there that you need to know about hepatitis. So you must give all your family members vaccine for hepatitis B. If hepatitis C is positive, hepatitis C has a cure. So you need to meet the doctor and they'll get that treated for whoever is positive. And for those that got HIV 1 and 2 as an accidental finding during routine investigation, it is a good thing that before HIV 1 and 2 test is being done, they used to cancel people. All right, they don't just cancel, they don't just take your blood and be running it for HIV. So immediately after that result, they will also cancel you and give you help. Okay, the drugs are free in the hospital. It's not the end of the road. In fact, it's being curtailed, and a lot of the fear that used to be associated with it is now being downplayed, because there is a treatment, there's a management plan. People marry, they bear children, and their children will be free from HIV and all that. So another test you need to do routinely after the liver function test, okay? If for a man, you do prostate-specific antigen. If you're a man above 45 years, all right, you do prostate-specific antigen routinely. As you age, you can reduce the frequency. But for a younger adult, a younger male, you can be doing every year. And the normal range is between 0 and 4 nanogram per ml. All right. So when it's beginning to rise, they can evaluate you and look out for why it's rising. There are values that are in keeping with cancers. I told you, early diagnosis. Prostate cancer is one of the preventable cancers if you are able to follow precautionary measures. Okay, because if they tend to see the rising prostate-specific antigen and it's in keeping with malignancies, there are procedures that can be done to starve the cancer of hormones. So they remove those organs that are producing the hormone, and that can help in the management of this prostate cancer. So prostate-specific antigen is something you should do routinely as a man when you are above 45 years. Another test you need to do routinely for a woman, okay? A woman that is above 40 years, you should be doing routinely pap smear. And for women that are younger, there's human papilloma virus vaccine, the Gardasil and the Cervarix. I have a course, I have a lecture on that too. So you take your vaccines for younger women, and for older women, you do routine pap smear. Cervical cancer is also a preventable cancer, one of the preventable cancers. This is because it is caused by human papilloma virus, strain 16 and 18. And if the vaccine is given, it's protected. An early diagnosis, doing a pap smear, is something that will help in the management and the prognosis of cervical cancer. Another test you can do routinely, you can do a mammogram, all right? A mammogram to rule out any malignant tumor, or to rule out any malignant transformation in the breast, so that you can diagnose it early and manage it early. Okay, mammogram is something you should do routinely. When you are able to do a routine checkup, this will help you prevent disease, support your health, promote health, and manage whatever clinical condition you are in very well, and then you live otherwise a healthy life. Okay, another thing you need to do routinely is checking your eyes. Okay, you need to check your eyes. A lot of people, they don't go to the clinic, they don't go to eye clinic. In fact, ophthalmology clinic is the least patronized in terms of routine checkup. Until they are not able to see well, until they are having headaches, that is when they visit an ophthalmologist. The eyes are very important. In fact, blindness is a very terrible clinical condition, and there are things like the increased intraocular pressure, glaucoma, when you diagnose it early, you are able to prevent blindness, because blindness from it is irreversible. So what you have to do routinely is to visit the ophthalmologist so that they can check your eyes, check your intraocular pressures, check your rays, you know. And for people who have refractive errors, they will check and correct that. All those headache and tiredness you get from the eyes can be sorted when you have your refractive errors sorted, either by giving glasses or be cancelled. So you must see the ophthalmologist too. You must see the dentist at least once in a year. They look at your teeth. They can help you remove caries, wash your teeth, and ensure that your teeth, they are in place. You know, most times people don't care because they think that if you lose your teeth, you cannot die. Except something is putting you at risk of death. They don't want to look at it as being important. The teeth too is very important. Have you seen somebody having pain from the origin of, when you say toothache? Toothache is a very severe form of ache, you know, severe pain with headache, agonizing pain. So it is better to prevent it than to experience it. Okay, and the mortality of a tooth is also important. Cosmetics too. Imagine a young adult with open and a wide tooth loss area. You know, you won't look fine cosmetically. For the fact that you can always have a denture put in it, does not mean that you should be careless. You can protect the ones you have there. And again, I think they have recent things that help whiten your teeth and all that. You need to see a dentist, all right, at each time as a routine checkup. If it's once in a year, it's okay. You need to see the ENT surgeon. They need to look at your ears and be sure that your ears are okay. When I mean ears, there is nothing that is blocking your ears. The ear wires, sometimes they clean the ears too. Okay, they just clean, check up. Say, I just came to check my ears. Ensure that you are taking routine evaluation seriously. Like I told you, it will not put there what was not originally there. Okay, and for whatever symptoms that you have, don't tolerate symptoms. Okay, somebody would not say for the past 4 months I used to pull blood. 4 months and you are at home. That's carelessness. Okay, present early. And when you present early, something can be done early to achieve a better result. There are some things that would have been cured instead of being managed. Okay, hope you have learned something today. If there's something more that you need to do a routine checkup on in the course of this video, I'll just type them. As you are listening, you are to read along. Have a great day. I'm always here to give you information that will help you prevent disease and live otherwise a healthy life. Bye.